Hey guys, Dr. Tom Toothaker here, physical therapist at the Orthopaedic and Spine Center, here to talk to you about compression band assisted mobilizations and stretches. So this is one of the many tools we use here to gain range of motion and mobility in a joint, such as the shoulder, elbow, knee, ankle. So what happens is you take this band, you wrap it tight, real tight around a joint. You have muscle, fat, fascia, the different layers that should slide and glide as you try to move through a range of motion. So this will help improve that mobility by having those layers slide more easily once you take that band off. Also, our goal is to help promote healing. So when you put this band on, wrap it tight, move that joint through ranges of motion. There's a decrease of the waste that's being moved out of the system, and then there's increase in blood flow or reperfusion that happens once you take the band off. And you'll see that here in just a second as I demonstrate on Zach. So we're going to do Zach's shoulder. He's going to put his hand up on my shoulder. So you can see we're going to wrap this real tight. At the same time, we're not wrapping this so tight that we're causing any damage, right? So this is only going to be done in about 1 to 2 minute intervals because of how tight the band is. Again, the goal is to decrease blood flow temporarily and then use reperfusion to help heal that joint or that tissue. All right, Zach's going to lay down at his back. Keep your arm right there. Lift your knees up a little bit. Lift your head up. All right, so then we take Zach and we're going to move him through just different ranges of motion. So I'm going to move it over his head. Nice and easy. I'm going to bring it out to the side. So I'm just moving him through all the planes of motion that his shoulder normally moves. And so, how about sensation? Feeling
a little tingling.
Yeah, so your hand will start to tingle a little bit. You might start to see that all of a sudden the skin starts to turn white, maybe a little bit blue. It's about time to take that band off. So hold the arm right here. All right, I'll have you sit back up. So you've seen his shoulder right here on the edge. There was a white discoloration at first, and all of a sudden it starts to turn that nice deep red as blood flows back into the system. So this is one of the many tools that we use here at the Orthopaedic and Spine Center to increase range of motion and mobility. This typically is something you would use. It could be post-surgical in the later stages when we're trying to get those last few degrees of motion. It could be after an injury, a sprain or a strain, or if there's just general joint stiffness. This is a definite good adjunct to the many tools that we use here.